Are you a manual therapist ready to expand your clinical reach and deepen your effectiveness? Upledger Craniosacral Therapy addresses deep restrictions, supports neurological and fascial systems, and enhances whole body function by working with the body's natural healing processes. For over 40 years, Upledger Institute International has led the field of craniosacral therapy, offering an approach that integrates seamlessly into any manual therapy practice and supports common to complex and chronic conditions. Find a class near you at upledger.com/courses or call 800-233-5880 extension 2 and begin your craniosacral therapy training for as little as $100 a month. Physical and emotional burnout affect most massage therapists, and many leave the field within a decade. Created by Fernando Rojas, Massage Hall of Famer and Master Somatic Therapist and Educator, Somatic Mindfulness bridges somatics and bodywork, teaching self-care as a professional skill. It makes the therapist's well-being the method, not just part of the formula. By prioritizing resilience, therapists create the conditions for healing for both client and practitioner and renew their insight and clarity of purpose. Visit somaticmindfulness.co to learn more. At Heights Retreats, massage therapists build stable and meaningful careers rooted in wellness and care. A place where therapists are dedicated to delivering exceptional care to the guests, not to filling their schedule. Heights Retreats care deeply about their therapists, our profession, and wellness itself. Grow with Heights as they evolve into a wellness-driven future. Visit heightswellnessretreat.com for more information.
The term shin splints has become a catch-all phrase to mean any pain in the front of the leg, just as sciatica has come to mean any posterior hip pain, and plantar fasciitis any foot pain, and even the definition of the leg itself has come to refer to the entire leg as opposed to the portion of this limb specifically from the knee to the ankle, which is more technically correct. These misnomers have created some confusion. Understandably, we live in a world oversaturated with information, which means the people vying for your attention are going to use clickable, easy-to-recognize terms, which means their content is more likely to be interpreted as truth more often than not, which means less nuance and more misinformation. It's fine, I guess, but just like the work we can do for a client who suffers from shin splints, we are going to want to lean in, parse through the muck and the mire, and get to the nitty-gritty, so to speak. When someone presents with shin splints, there is a lot to consider. The physiologically correct term is Medial Tibial Stress Syndrome, or MTSS for short. And while that might sound like I'm just getting fancier with my terminology, this distinction actually matters. Because when someone comes to you with leg pain, it could be a whole host of issues masquerading as shin splints. Muscle strains, Achilles tendonitis, plantar fasciitis, or even a tibial stress fracture. So getting clear on what we're dealing with is a step in not making things worse. According to the National Library of Medicine, medial tibial stress syndrome is an overuse condition, specifically a tibial bony overload injury associated with periostitis, or inflammation of the connective tissue that surrounds a bone. And clinicians commonly encounter this in participants of recurrent impact exercise, like running and jumping sports, as well as the common trainings of military personnel. So in other words, the shin bone, or the tibia, and its surrounding connective tissue, the periosteum, becomes exhausted from a high demand due to doing active things while on our feet. But if we dig down into the nitty-gritty of it, what I find most fascinating about MTSS is the incredible adaptive capacity of bone tissue. Our bones are not static structures. They're constantly responding to the demands we place on them. And when you consider that our legs are bearing the weight of everything from our knees up, that's a considerable demand on the muscles that live in the leg and control our ankles and feet. When a muscle faces this level of consistent force, And this is especially true for high-performing athletes, or really the athlete in any of us who pushes ourselves beyond what might be considered normal. Those muscles and their fascial sheaths, the paramecium and the epimecium, pull at the periosteum, that aforementioned connective tissue that covers bone. The bones, being the adaptive badasses that they are, respond by producing more osteoblasts, or bone-forming cells, to meet the demand and actually grow more bone. This is bone remodeling at its finest. But here's the catch. When the demand exceeds what the bone can handle, when we're asking for more adaptation than the tissue can provide in the time frame we're giving it, this is when medial tibial stress syndrome sets in. I always say that a person's greatest asset is also their biggest downfall, and I guess this is true for our bones as well. The usual suspects in MTSS are a motley crew. The tibialis posterior gets blamed for shin splints more than any other muscle, and for good reason. It's almost always involved. But it's not the whole story. The flexor hallucis longus and the flexor digitorum longus are also major players in this drama because, what your toes do affect how your shins feel. And the tibialis anterior can't not chime in. It's leading the pack, so to speak. So, it will more often than not be symptomatic. Pro tip, when palpating, it's a good idea to remember that the tibialis posterior attaches at the proximal half of the medial tibia, so the upper portion of the inner shin bone, while the flexor hallucis longus and the flexor digitorum longus, on the other hand, attach more at the distal half or the lower portion, closer to the ankle. This distinction is crucial because it changes how we approach our work. It changes where we focus our attention, and it changes what questions we ask. Look at it this way. Working with shin splints can feel like navigating that overwhelm of information that exists on pretty much any topic these days. You're scrolling, you see an enticingly crafted clip on something you happen to want to know more about, and you have two choices. Accept this influencer's podium speech as truth, or do a little investigative research and find out if you're on the right track or not. With shin splints, starting with a gentle approach, some slowed intentional effleuraging is the scroll. But maybe your client winces, or maybe you feel some tension or palpate some adhesions. It's super easy to stop here and focus all of your energy on this one spot. Or you gather more information, assess what you're dealing with, and then curate your work as you go. The more you know, the more appropriate your work becomes. Adjusting your focus also often, and especially with shin splints, means adjusting your perspective. Positioning matters a lot. I frequently begin my assessments with my client prone or supine, but after I gather plenty of useful information and I want to get into the nitty-gritty, accessing the medial leg and working with precision involves repositioning my client to lay on their side with some bolstering. And as a bonus, my body mechanics are spared. Picture this, because this is a podcast and not a video. Your client is side lying with the top leg positioned back and the bottom leg pulled forward. The top leg is bolstered to keep the hips neutral, and the bottom leg is undraped so that the entire medial surface of the leg is exposed and easily accessible. This position gives you full visibility and access to the medial tibia, lets you work at multiple angles, and allows you to follow the tissue, work where you need to, and focus without contorting yourself or compromising your work. From this position, you can differentiate between the three muscles we're talking about. You can palpate the proximal half and access the tibialis posterior. You can move distally and evaluate the flexor hallucis longus and the flexor digitorum longus. You can follow fascial connections, and you can work with appropriate depth and direction without fighting gravity or inadequate access. Your initial touch should be exploratory. Use a broad contact to assess tissue temperature, texture, and tone along the entire medial border of the tibia. Notice where the tissue feels dense, where it feels reactive, or where your client winces or guards. This is your roadmap. Once you've gathered that information, you can start working more specifically. If you're dealing with proximal symptoms, you're likely looking at the tibialis posterior involvement. This muscle originates from the interosseous membrane and the posterior surfaces of both the tibia and the fibula. So your work might need to address not just the medial tibia, but also include some lateral leg attention. If the symptoms are more distal, consider the flexor hallucis longus and the flexor digitorum longus, both of which have different fiber directions and fascial relationships. Asking your client to engage their toes with either of these muscles will reveal a heap of information. The work itself should respect what we know about bone adaptation. Remember, the periosteum is being pulled on by overstressed tissue. Your job isn't to dig into that periosteum hoping to release it. Your job is to address the muscular and fascial tension that's creating the excessive pull in the first place. Work with the muscle bellies, address the fascial sheaths, and create length and pliability in tissues that have been locked in a pattern of overwork. And this is where I'm going to push back against conventional wisdom that says you should avoid the painful area. Yes, you should work intelligently. Yes, you should respect inflammation and acute injury. But chronic MTSS benefits from direct, appropriate work to the involved tissues. If you're only working peripherally, you're missing the point. Think about the mechanics here. These mechanics are controlling ankle and foot position through every step, every jump, and every change of direction. They're maintaining arch support. They're managing pronation and supination. They're absorbing impact forces that travel up from the ground. So when they can't keep up with demand, when they're tight and restricted and unable to lengthen and load properly, they pull harder on their bony attachments. More pull means more periosteal stress. More periosteal stress means more pain and more dysfunction. Your work should address the entire muscular chain. Don't just focus on the symptomatic area. Look at the foot, look at the ankle, look at how the knee is tracking, look at hip position and glute activation, because while the pain might be presenting in the medial leg, the dysfunction often has roots elsewhere. Also, one of the most challenging conversations to have with a client, especially those clients who are weekend warriors, is about rest. Sometimes the best thing you can do for shin splints is educate your client about the importance of rest and its relationship to load management. Our hands-on work is valuable, but if your client goes right back into the same training volume that created the problem in the first place, you are fighting a losing battle. Bone adaptation takes time. Tissue healing takes time. Progressive loading that respects those timelines is what allows the body to build resilience rather than accumulate damage. This doesn't mean your client needs to stop all activity. It just means they need to modify intensity, duration, and frequency to allow adaptation to occur. It means incorporating strength work that builds capacity in these muscles so they can handle the demands being placed on them. It means potentially addressing biomechanical issues that are contributing to excessive stress. Your role as a massage therapist in this scenario is multifaceted. You're providing hands-on work that addresses tissue restriction and facilitates healing. You're educating your client about body mechanics and self-care. And in super ideal scenarios, you're potentially collaborating with other practitioners, physical therapists, athletic trainers, and physicians to ensure comprehensive care. You're helping your client understand the difference between pain that means back off and discomfort that comes with tissue change and adaptation. The bottom line with medial tibial stress syndrome is this. It's a condition that develops when demand exceeds capacity, when we ask our tissues to do more than they're currently capable of handling. Our job is to help restore that capacity through intelligent manual therapy to address the muscular and fascial restrictions that are contributing to excessive periosteal stress and to support our clients in making the training modifications necessary for long-term resolution. So the next time someone comes to you complaining of shin splints, take a deep breath, sort through the information, get them positioned properly, assess thoroughly, work specifically, and remember that behind all the clickbait and misinformation, there's real anatomy, real physiology, and a real human being who needs our help navigating a path back to performance.
Elevate your bodywork career with Anatomy Train's Structural Integration Certification, ATSI. Discover how to map the pattern and shape the change through inspiring lectures, hands-on body reading, and practical techniques you can use in your practice right away. Join us for ATSI Maine 2026 to 2027, where Tom Myers will personally kick off this transformative professional training. Learn more at anatomytrains.com/ATSI. Precision Neuromuscular Therapy has been teaching high-quality seminars for over 20 years across the country. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org.